Okay, so the last section of Chapter 7, Controlled Substances Part 3, is on hypodermic needles and syringes. A pharmacist can furnish hypodermic needles and syringes to patients without a prescription in the following situations. The pharmacist knows the patient and the pharmacist has previously been provided with a prescription or other proof of legitimate medical need for the needles and syringes. For example, if the patient is insulin dependent. Another situation, if the patient is 18 years of age or older, it can be provided as a public health measure to prevent the transmission of HIV, viral hepatitis, and other bloodborne diseases among persons who use syringes and hypodermic needles, and to prevent subsequent infection of sexual partners, newborn children, or other persons. There is no limit on the number of needles and syringes that could be provided. Another situation would be when you're using these hypodermic needles and syringes for animals, as long as the animal's owner is known to the pharmacist or the person's identity can be properly established. And then if there's a situation where you're using hypodermic needles and syringes for industrial use, this would be determined by the Board of Pharmacy. Pharmacies that sell syringes without a prescription and syringe exchange program must store needles and syringes in a manner that ensures that they are not accessible to unauthorized persons. So obviously that's behind the pharmacy counter. They have to provide for safe disposal of needles and syringes. So sell and furnish sharps containers and mail back sharps containers opportunities. There would be opportunities also that the pharmacy provides for on-site sharps collection dates and disposal programs. And then, what is the last one here? So, it is definitely also a good resource for patients to be able to come into the pharmacy and have the pharmacist be able to provide, or the pharmacy staff be able to provide written and verbal information to customers at the time of sale on how to access drug addiction treatment programs and testing and treatment clinics for HIV and hepatitis C, and also to provide information on how the patients might obtain these safety sharps containers. So that is the last section of Chapter 7 under Controlled Substances, Part 3. Then we're going to move into Chapter 8, where we get into auxiliary labels. So auxiliary labels are placed on the container, as we know, and they alert the patient and healthcare providers and nurses for key warnings, storage and administration requirements, and maybe even some dietary requirements that have to do with certain medications. An example is with central nervous system depressant effects that happen with certain medications. These can slow down reaction times and cause motor vehicle accidents. So to increase public awareness of side effects of certain drugs and to reduce driving under the influence, the board has mandated a warning label which states, do not drive a car or operate heavy machinery while using this medicine on select medications. Auxiliary labels should be evidence-based and written in simple language. They should be placed in a standard location on the label. should be provided for each prescription in which the use is appropriate. This list contains select auxiliary labels used in dispensing medications. It should not be considered exhaustive, but it does represent major categories of labels. So we're going to look at some key warnings on the aux labels. So one label would say, it's in yellow typically, and it would say, caution, federal law prohibits the transfer of this drug to any person other than the patient for whom it was prescribed. So basically, as we know, this means that federal law requires Schedule 2, 3, and 4 drugs that they have this warning. Another important label looks like a skull and crossbones, and it's a caution label. And it says opioid, risk of overdose and addiction. So, state law requirement for drugs that contain single or combination opioids. All opioid prescription bottles must contain the notice. This is in addition to the cautionary statement required under federal law, which prohibits the transfer of any controlled substances to other people. Additionally, there's a caution label which says, do not take with alcohol or non-prescribed drugs without consulting your doctor. So state laws require that we include this for drugs that can't be taken, for example, with alcohol. So some of these drugs that we're going to talk about pose a substantial risk when taken in combination with alcohol. So when we think about disulfiram, like in metronidazole, even tinidazole, and what this disulfiram-like reaction basically does is it makes you really sick. So your body wouldn't be able to metabolize the alcohol. So you would want to avoid alcohol for 48 hours after your last dose. Also with monoamine oxidase inhibitors, with any nitrates, with anti-diabetic agents like insulin, metformin, sulfonylureas, because of low blood sugar risks. Any other drug which, based upon a pharmacist's professional judgment, may pose a substantial risk when taken in combination with alcohol, includes opioids, all but a specific warning for long-acting formulations, tramadol, benzos, barbs, non-benzos, anticonvulsants, antipsychotics, some antidepressants, and skeletal muscle relaxants. And then one additional aux label you will see with this group here would be may cause drowsiness, use care when operating a car or dangerous machinery. So again, state law requirement to include this for drugs that can impair a person's ability to drive and operate machinery, The following drug classes require a warning on the prescription label of the drug container. So like muscle relaxants and analgesics with CNS depressant effects, antipsychotic drugs with CNS depressant effects, antidepressants with CNS depressant effects like trazodone, mirtazapine, antihistamines, anticonvulsants, antihypertensive drugs, motion sickness drugs, antipyretics, antiemetics that all have CNS depressant effects, any narcotics and controlled substances that are scheduled 2 through 5 that have CNS depressant effects, and sedative hypnotics, anticholinergic drugs that may impair vision, and any other drug which, based on the professional judgment, may impair a patient's ability to operate a vehicle or vessel. For example, dopamine agonists such as ropinirole. We're going to go ahead and take a pause here.